more minutes
And
to get logged in.
we are live streaming on Facebook, Sandra, so the show is all yours.
Welcome, everyone. See folks trickling in.
While we're waiting, if you feel free to put your first name and where you're joining us from.
And if you have any questions, you already know you have. There's a question and answer function at the bottom of your screen that you can use. And we'll answer some questions during the question and answer portion at the end of the presentations. All right, does everybody see that welcome screen? Awesome. Well, let's get started, folks. We're so glad to have you here today. Colorado Rising and Larimer Alliance for Health, Safety, and the Environment are so excited to host this educational webinar for everyone. We're going to be taking some time to listen to some expert panelists this evening. And at the end of our program, we'll have a question and answer portion. So you can save your questions till the end. We might be able to take a few brief questions after each panelist, depending on how we're doing on time. So we're going to start with an introduction by Larimer Alliance.
Good evening. My name is Gayla Maxwell Martinez, and I'm a member of the Larimer Alliance for Health, Safety, and the Environment, a group of citizens committed to protecting Larimer County from harm by oil and gas development. We want to thank all of you who have chosen to join us this evening, and we wish to especially welcome Larimer County Commissioner Kristen Stevens. Thank you. With the invaluable help and support of our partners at Colorado Rising, we have put together a webinar designed to answer some of the questions about what is in our air. The air we breathe is the primary medium of our existence. We tend to take it for granted. We assume that it will always be there for us and that it will have the qualities necessary to sustain us. But we can no longer reliably and consistently make that assumption. There is much we do not see. I'm now going to turn this over to Sandra Dugan, who you just heard speaking, so that she can introduce to you our three panelists for the night.
All right, so our first panelist this evening is Andrew Klooster from Earthworks, and he is going to be speaking a little bit about what is in our air and about how he and Earthworks help us know a little bit more about the air we breathe.
Great, thank you. 1 second while I share my screen here. You can all appreciate my dog sleeping in the background, bored out of her mind by this topic. Great, can everyone see that? Awesome. All right, so as Sandra said, my name is Andrew Klooster. I'm the Colorado Field Advocate with Earthworks. And tonight I'm going to kick things off by taking you all on a virtual field tour of pollution from oil and gas extraction facilities in Colorado, and hopefully provide some context so that when Dr. Carroll and Dr. Helmig, our other speakers tonight, get to their presentations, you'll have a pretty good grounding in what pollution looks like from oil and gas facilities and where it is occurring at these facilities. So I'm going to do this, I'm going to take you on this tour by sharing with you footage from our optical gas imaging or OGI camera. So OGI cameras are specially designed infrared cameras that allow the users to see pollutants that are otherwise completely invisible to the naked eye. The camera that I use and I'm trained and certified to use is the exact same camera that the state of Colorado uses and operators themselves use to conduct inspections of oil and gas facilities. And that's because this camera allows us to see methane and allows us to see other volatile organic compounds or VOCs such as benzene, which are the major pollutants from oil and gas facilities. And outlined on this slide in these bullets is just a general overview of how we conduct our fieldwork with our OGI cameras. So we're looking at oil and gas facilities that are either brought to our attention by the concerns of community members who are concerned because maybe they smell odors, or maybe they're concerned about the proximity of a certain facility to homes or schools. We also look at facilities just based on kind of regional random surveys where I'll drive around in a municipality and look at every facility that I can get a good viewing angle on, either from a public roadway or public land. And if we do see things with our OGI camera that are going on, pollution from things that may be violations or malfunctions or leaks, we'll document those sources and we file complaints with state regulatory agencies, primarily the Air Pollution Control Division, as air pollution is their purview in our state. I'm going to move through the next two slides really quickly because I know the next two speakers are going to focus a bit more on health impacts and air quality impacts of oil and gas pollution. But just to set the stage here and provide some context for what I'm going to share, I think it's hopefully pretty obvious to many Coloradans, most of us, that climate change is an ongoing and real and present thing. We can see it in the intensifying droughts. We can see it in our severe wildfires. We can see it in our worsening air quality and ozone on the Front Range. And one of the major kind of drivers of climate change at present and from our state is methane. And that's because methane is essentially an accelerant for global warming. It's at least 86 times more potent as a greenhouse gas than carbon dioxide while it's in the atmosphere. And as I've mentioned, methane is a major pollutant from oil and gas facilities. Focusing really quickly on ozone as well, because another, as I mentioned, pollutant from oil and gas facilities are these non-methane volatile organic compounds, some of which are ozone precursors. So they lead to the formation of ozone. And I'm sure Dr. Helmig will have more to share on this, but I'm just putting this slide up here to demonstrate, and this, I don't want to spend any time on this really, but this is provided by the state of Colorado. It shows you some monitoring stations in and around the Front Range. And these values, as you go across the table across the years, are parts per billion averages of ozone. And really the takeaway here is the trend line, which is that all across the Front Range, air quality is getting worse. Ozone's getting worse. One of the main contributors to that is oil and gas activities in our state. So before I get to the videos, which I'm sure is why you're all here, I'm just going to provide you with a quick overview of the our fieldwork in general in the last year or so. So in last year in 2021, I conducted 266 OGI surveys of 185 facilities. And there's a bit of discrepancy there in those numbers because we'll often revisit facilities when I have filmed emissions at a facility or filed a complaint on a facility. And last year in total, I filed 54 complaints based on my footage with the Air Pollution Control Division here in the state. This year already, and many of the videos I'm going to focus on and show you all today, out of one round of field work in the Front Range in end of February, I have already conducted 62 surveys of 56 facilities, and I filed 17 complaints with the Air Pollution Control Division. So a full third already of the complaints that I filed in total last year. This return on investment is still honestly disturbingly high if you take for granted what Colorado likes to say about itself, which is that we've passed the rules and the regulations in order to start to rein in this industry. I like to say that there's a difference between the rules as they're written and the reality on the ground. And right now, the reality on the ground that I see with my OGI camera and we show through our fieldwork is that pollution from this industry is still extraordinarily pervasive. And that's because there's not enough oversight and not enough enforcement. And we'll talk about that as I continue with my presentation. The last thing I have up here on the slide is just a quick sort of overview of where we're primarily filming emissions when we're filming facilities in Colorado. We film a lot of emissions still from drilling and fracking, or the pre-production phase of a well's life. These tend to be some of the most emissions heavy events, time periods in a well's life cycle. However, they're not the only times you're going to see emissions and pollution from a well. On a producing well and even abandoned and shut-in wells, you will see emissions due to malfunctions, leaks, negligence, human error, and at times intentional violations such as venting. And one last slide before I get to the visuals. This is going to be my framing as I walk through and share with you all some of the footage, most of which, as I said, I just captured a few weeks ago. But there's 4 main takeaways that I want you to keep in mind, and I'll try to return to them as I go through. The first of which is that pollution occurs at all extraction facilities of all sizes, single well sites all the way up to the multi-well pads that we're so familiar with on the Front Range. And it occurs throughout the life cycle of these facilities. So as I said, the pre-production phase tends to be a really pollution intensive phase, but by no means is that the end of the pollution or the potential pollution that is going to occur at an oil and gas facility. All throughout a well's life, there's the potential for pollution, including even after a well has been shut in and abandoned. The other point I want to emphasize right here is that harmful pollution does not occur, and as I've said, does not only occur during the drilling and fracking phase. And really, I want to put a fine point on this because what I'll show you is that intense emissions events are not only associated with drilling and fracking. I think that tends to be the conception, and a lot of our rules and regulations are designed to protect residents during the pre-production phase, and that's good. But large emission events are not exclusive to the pre-production phase. And I will give you some examples of what this looks like. The next point is that pollution occurs frequently, and that's because leaks, malfunctions, and human error are so common. And I will demonstrate that as well. And then the last one, which I'll also have an example of, and for us to keep in mind, is that the repairs and interventions, even if we have found a leak or a malfunction and the operator has corrected that, these repairs and interventions do not always work, or sometimes they only work for a temporary amount of time, a couple of months, a couple of weeks, and we'll return to the same facility and find either the same emissions ongoing or a new problem. So now jumping into the visuals themselves, and I'll start by elaborating on that kind of first point I shared by walking through the life cycle of wells. So this is the extraction oil and gas. Well, technically it's a Civitas Resources, but I will be referring still to many of these pads as extraction pads because their signage is still extraction. On the COGCC database, they're still extraction pads, but extraction has now merged with other operators to become Civitas Resources. But this is the extraction oil and gas interchange pad A in Broomfield. What you see on the left-hand side of the slide here is a digital photo taken with a camera. What you see on the right-hand side is what my OGI camera was seeing set up on its tripod as I took this photo on the camera. So you can see in the digital photo, you see the drilling rig, the sound wall, you see that home in the foreground. You don't see any evidence of emissions with your naked eye. You look at it through an OGI camera, and what you see in this clip on the right, you see a cloud of methane and other VOC emissions emerging from around the drilling rig and proceeding up from the sound wall, and in this case, drifting towards Broomfield, the city and county of Broomfield. This is a pad that is drilling right now, so that's a drilling rig setup. This is the beginning of the well's life cycle, and as I mentioned, intense pollution that occurs during this pre-production phase, as you can see in this OGI video. One last note on this pad, these Broomfield pads, these extraction pads in Broomfield are held up as having some of the best state-of-the-art management practices to reduce their impacts on the nearby residents, because there are many nearby residents for these pads. I can't speak to whether or not they are really reducing impacts, but I can tell you, and I can show you right here, that they're not having much of an impact on the air pollution. This is also another pad in pre-production, just to drive this point home. This is Great Western's rain dance pad in Windsor, just in the Weld County side of Windsor. This video, and you'll see on all these videos, there are timestamps. So you can see that these were all taken, most of them, again, were taken just a few weeks ago. Once again, you see a cloud of methane and other VOCs emerging from behind the sound wall here, rising high into the atmosphere and then getting carried by the wind way far away from the pad. One unfortunate thing about filming pads in pre-production with the sound walls up is I can't identify the source for you. I don't know exactly what the source of these emissions are, but I can tell you that there are definitely emissions occurring. Moving along in the well's life cycle. So once you're done fracking, your well is just producing, and it can be producing for decades. And once again, just because drilling and fracking are over does not mean that you have now reached the end of the story of pollution. In fact, it's really just the beginning. So this is another pad, an extraction pad, Pavisma in Windsor. This is right next to the Rain Dance development, which is a large new development with hundreds, if not thousands of homes now. And what you see here in the OGI footage, you see the digital camera switches to the OGI footage. You see a row of trucks, and behind there's a row of stacks. And those stacks are combustors for separators. Each of those is a separator. And what you see coming out of those stacks from 2 of them in the middle of the footage there, are emissions that are just venting out of those stacks. So these separators are malfunctioning. If they were functioning properly, they'd be combusting any excess methane and VOCs. We wouldn't see a trail of pollutants like that emerging from the top of those separators. But malfunctions, as I've mentioned, occur very frequently, and this is something that can lead to emissions on producing pads. So once your pad is potentially, or your well site is getting near the end of its life, it may be shut in at times, it may become inactive, it may eventually become inactive for a while before it's hopefully plugged and abandoned. So this is a well, this is actually one of the few pieces of footage that is from last year. This is a well on the western slope that was shut in at the time that I filmed it, which means it was not active, was not producing. There was no activity on this site. This, what you see here in the image is the well head itself at the base of a pump jack. And on the right-hand side, you see what is emerging from this wellhead. Methane and VOCs leaking out because the wellhead casing was worn. So again, this site was not active, but even shut in, you can still get instances where you're going to have pollution from a site. And that is emphasized even more in this example. This is an orphaned well, which means the operator has walked away from their obligation. They went bankrupt. They're no longer obligated to clean up this facility. It's on federal land. So hopefully at some point, federal funds will mean that this facility gets cleaned up. The important thing here, and this was filmed in the summer of last year, is that this facility has been inactive for years, at least since 2019. And what you see in the footage is that the tank is venting. And that's because when the operator went out of business, they didn't fully empty these tanks. The liquid inside is volatilizing, and we're getting emissions pollution as a result, venting from this tank. Presumably it's been doing this for at least the last 3 or 4 years while it's remained inactive. And it will continue to do this until the funds are there to clean this up. So once again, the whole life cycle of a well, you're going to get potential for pollution. Returning to the other point I made in that first point, main takeaway, it doesn't matter the size of the facility, there's the potential for pollution, and there's potential for this pollution to be harmful to nearby residents. So this is a KP Kaufman site in Adams County. This is Adams County Golf Course. What a wonderful name for an oil and gas facility. It is a single well pad. And you can see in the background on that hill, there's some new houses being developed. This is also right next to a high school athletic field in Adams County. And what you see on the left is this tank with a long stack coming out of the tank, a vent stack. And on the right-hand side in the OGI footage, you can, if you're looking at the top of that stack and as it moves across the screen, you can see a steady plume of pollutants coming out of that stack. These are just methane and VOCs being directly entering into the atmosphere without any intervention. This is what we call venting. Another set of tanks, but this is on a much larger site. So this is a multi-well facility. This is, we see a lot of these in the Front Range, huge tank batteries, huge facilities. This is just to drive home again that pollution can occur at any size facility. So this is another set of tanks. This is south of Meade. This is Crestone's Liberty pad next to a new residential development, as many of these pads are. And what you see here is a steady stream of pollutants, of methane and other VOCs coming out of what I presume is a hatch on top of the tank, which may have a seal that is broken or needs to be cleaned. But this is a form of pollution we see often with hatches that need to have some maintenance done on them. If the seal is a little broken on the hatch, you're going to get pollution coming out of that tank, venting directly into the atmosphere. To my second point that I made in that framing slide, which is that you're not going to only see massive emission events during drilling and fracking. So, and if you recall, back to those original slides, there was a ton of emissions coming off of those drilling and fracking pads, and that's important. And again, many of our regulations are written to protect people from the emissions, the impacts of the pre-production period. But you can still get awful emissions during a well, any time in a well's life cycle. And this is an example. This is Extraction's Diamond Valley East Pad, which is also in Windsor. It's actually right next to where the city of Windsor plans to build a youth sports complex. And what you see here on this pad, this infrastructure on the right is a compressor. Compressors are used to compress methane and let it move more smoothly through a system, potentially be re-injected into a formation. If this compressor was operating normally, it would be combusting a ton of this excess methane, and we wouldn't see this huge cloud of just methane and VOCs basically pouring out of this piece of equipment. Another example of a large emission event on a producing pad, this is the Cub Creek Night Pad. It's just outside of the city of Longmont and north of the Union Reservoir. I've filmed it many times over the last year, and most recently was filming it in late December when I was concerned about emissions from these tanks. And you can see when it goes back to just photo, you can see this line of tanks. They're produced water tanks, and I filmed emissions from them in December. The state also filmed emissions from them in December, and Cub Creek supposedly repaired the hatches on these tanks. I, however, filmed emissions from them later in December, and as we can see in this video from February 27th, I filmed continued emissions from these tanks and extreme emissions. This video, the video that this clip is pulled from, is much longer, and I tracked that plume and tracked that plume and tracked that plume, and I never honestly found an end to it. This is a huge emission event. It's not associated with drilling and fracking. These are just tanks that are potentially venting, or there's some additional issue with their pressure release valves or hatches. But the end result is enormous emissions that are potentially harmful to human health. And in this case, as with many of the wells that I've shown you, this is right next to homes. I was where I filmed this from, you can see a fence line. I was standing in the backyard of a home. I was standing right next to their play set for their kids. I mentioned that these issues that occur on well pads are common. This is another facility in Adams County, another KP Kaufman site, the Stanley site, also next to a residential neighborhood, also right next to a children's playground. This is a tank on a site. This is another low producing site, but what you can see here is what I'm assuming. I haven't heard back with the complaint from this yet, but I'm assuming this is a leak. I don't see a hatch on top of that tank, so I'm assuming this is a leak from this tank. But again, leaks are common problems that I observe all the time on facilities, especially low producing facilities that may not get inspected that frequently. And in this case, I filmed these emissions on the 20th of February. I returned a week later. I filmed the exact same emissions ongoing. So they at least were occurring over the course of that week. I would suspect that they've been occurring for much longer because, again, this being a low producing facility, who knows when it was last inspected. Just reinforcing this point about common problems and bringing this a little closer to home for many of you probably. This is a site in Larimer County. This is Prospect Energy's Hearthfire site just north of the city of Fort Collins in the Hearthfire neighborhood. It's another site that I have filmed repeatedly over the last year, and this footage is actually from last year. What you see in the image on the left is a kind of overview of the facility. You see a tank battery there. This is a crude oil tank battery. What you see on the right is zoomed into the top of these tanks. You see this steady stream of methane and VOCs coming out of it. This was another leak. Again, very common problem on these low producing sites. Prospect Energy, after we filed a complaint on this footage, did repair this leak. However, we returned in, I was there just a couple of weeks ago. And honestly, this could, in my mind, almost be the exact same footage if it wasn't for the timestamp. That leak has either returned or there's a new leak, but the end result is continued emissions from this same source. And then just to close out here and kind of touch again on a point that I've made with a few of these pads already, but to emphasize it even more, is the fact that repairs that operators do and interventions that they take don't always work. And in fact, one of the reasons, as I said, that we return to facilities time and time again is because if I filed a complaint on a facility and I've seen emissions from a facility, there's a really good likelihood and chance that if I return, I'll find continued emissions or new emissions from a different source. This site is also in Larimer County, also Prospect Energy. And at this point, I feel like is a little bit infamous because I've been talking ad nauseum about it for over a year now. But this is the Prospect Energy Krauss MSSU central tank battery. It's just about a mile, not even a mile north of the facility I just showed you. What we're looking at here are some produced water storage tanks again. So like what I showed on the Cub Creek night pad. And you see this plume of pollutants coming out of the top of this tank there. This was due to a leak. This was not the first time we filmed leaks from these tanks. This was in September of last year. This was in November of last year after the operator had tried once again to repair the leak and it did not work. And then my final slide, which is a somewhat depressing slide to end on. This is the site just a couple of weeks ago. So they were ordered by the state to replace those tanks that were leaking and they could not repair. So they did replace the tanks. Those are newish tanks. They're new to the site that are replacing the old tanks that run the site. However, as you can see, if you look at the hatch there in the footage on the right, and you kind of look at the surface of the tank because the pollutants were going down and moving across the surface of the tank, this issue has not been fixed. This intervention, even replacing the infrastructure on this site, has not solved the issue with constant chronic pollution from this site. This doesn't mean that repairs don't always work, but this is just a good example, and as some of those others that I shared, that repairs, there are many instances in which repairs do fail or repairs don't truly mitigate the problem and or that the problem arises again because a lot of this infrastructure is old. And if you have a leak from one part of a tank, you're potentially going to get a leak in another part of the tank before long. So this is my last slide, but just a quick recap of those main takeaways. Pollution occurs at all forms of facilities, whether it's a single well facility or multi-well facility. It occurs all throughout a well's life cycle. It's a common thing. I mean, again, if you're like me driving around with an OGI camera and really looking for it, you're going to find it far too frequently than you would hope. And it's not just the pre-production phase that we should be concerned about when it comes to health impacts. Any emission event can potentially have health impacts. This Krause facility being the perfect example, because it was only brought to my attention by the residents who live nearby who've been suffering from health impacts due to the emissions from this facility for years. So that's the end of my presentation, but I can keep my slides up if there are questions about specific slides and if we have time for that, or we can always return to slides 2 with the Q&A at the end, but I'll let Sandra, I don't know if there are any specific questions for me.
There are. I'd love to ask you a couple of questions real quick, and then we'll save the rest until the end of the webinar. I'm going to go back to my screen, Andrew, but if anything pops up,
Yep.
just let me know and I can boot. All right, you should all be able to see my screen pretty soon. All right, well, we have a couple of questions for you, Andrew. One of the first questions that came up was if you could reiterate how Earthworks can get on a site or how they can pay a site a visit.
Yeah, so we never actually access a site. We don't trespass, so I'm always filming from either a roadway or from public land, a public park. If I have the permission from a private landowner who is adjacent to a site, we may film from their property. As I kind of showed with that Cub Creek night pad, but I don't ever film on operator property. We do not trespass.
Okay, good. Thank you for clarifying that. Another question we had was, what do the colors in the flare footage represent?
Oh, thank you. That's a very good question. I usually try to foreground that. So they are meaningless in regards to what we're seeing. They're just filters that I can apply to the camera footage. Sometimes it's easier to see certain things with a different colored backdrop, but ultimately, no matter the color, no matter the palette that's applied, the information that's being conveyed is the exact same. The camera is seeing methane and VOC emissions.
All right, and then there was a few different questions kind of circling this topic, so maybe we can go back to it at the end of the webinar too, but can the camera estimate the concentration or volume of the emissions?
Not in and of itself. There is software that you can pair with an OGI camera to get some quantification. You have to, though, have as an input some idea of what the kind of composition of that plume is. You have to have an idea of how much methane or whatever else is in the plume. That's something that is, an operator would have to provide to me. I highly doubt there are very many instances in which that would ever happen. But so we don't quantify the emissions. It's not infeasible, but it's also kind of difficult given our situation.
Makes sense. Thank you, Andrew. We're going to move on to our next panelist. There's still questions for Andrew, and we'll address some of those at the end of the webinar. Thank you all for continuing to submit your questions. As a reminder, there's a Q&A button at the bottom of your screen. It helps us keep track of questions so that they don't get lost in the chat. But if it's easier for you to type them in the chat, you can definitely do that. And we're monitoring both, so hopefully we can address everyone's questions. So our next presenter is Dr. Helmig from Boulder Air. He will explain.
Actually, Sandra, you're skipping me. It should be Dr. Carroll, I think.
Okay, sorry about that. The presentation skipped me once. So give me 1 second. My PowerPoint tricked me. Thank you, Dr. Carroll. So we will be hearing next from Dr. Corey Carroll of Physicians for Social Responsibility, and he'll help us understand what happens when these toxic emissions enter our bodies.
unmute me. I hope everybody can see my screen, and I'll get rolling. So try to catch up a little bit on time here. For those of you that don't know me, I am Dr. Corey Carroll. I'm a family physician. I'm in Fort Collins, been doing this for about 30 years. And I'm quite passionate about helping my patients stay healthy. A lot of that has to do with their personal choices, but there are some components to that that basically are out of their control. And that's where I think it's critical for all of us to be aware of what's happening to our air, water, land, etc. To start with, I actually will share just a couple of let's see if I can get this to advance. Got to put that there. There we go. So this was this morning up at Young Gulch. I was hiking with my dogs. Beautiful, beautiful picture of the little falls that were there. The next shot, unfortunately, shows one of the concerns we have, and this was the wildfire that happened there years ago. Things are growing back, but it's going to take a long time. And I didn't even go up further in camera and then capture that. But these are some of the concerns. So to not be too negative, on my way out in the parking lot, there was this gentleman that was hiking. Now he's got a boot, a walking boot, medical walking boot on his left leg. He's on crutches. He's wearing oxygen, and he's hiking up in the in Young Gulch on this muddy trail. And I just had to give him a thumbs up, and he gave me a wave back with his crutches. So no matter what's facing you, there's a way of getting around it. So that'll be the message I want to leave you with. So another picture that isn't as exciting, and that's basically what's happening to us when we're breathing air that isn't as pure and clean as we wished it was. To be fair, there's always going to be some pollutants, particulates in the air, but unfortunately these have increased, and we'll find out a little bit more from Dr. Helmig, some of the atmospheric issues and other things. But this is a concern that we have. And if you don't know, from the American Lung Association, this was pulled up Monday, but we've basically had an F rating for ozone in Larimer County for a long, long, long time. Particulate matter, the 2.5 is basically the most dangerous particulate, and we get a C on that. Overall, annually, we pass, but this is not good news for us. The EPA has 70 parts per billion and below as okay. But you can see there's 4 other categories above that. Now, interestingly enough, when you look at other agencies like the European Union, they say, no, I think 60 is a little bit more appropriate for health. Canada's a little more open, moves up to 63, but the EPA has it set at 70. Now, this graph has got a little, probably hard to see at the bottom, but this goes back. It's interesting how the EPA quantifies this, but it's over basically an 8-hour period and a 3 years. So you'll see at the bottom, 1996 to 1998 is a 3-year period, and then it goes 97 to 99. So this is a data that goes all the way back, and unfortunately, we in Larimer County are well above the acceptable range for ozone, and we've never been below it. Not as bad as we saw in 2012 to 2014, but it is concerning. And what happens when ozone comes into your body? Well, one thing, it's basically a reactive element, which means it's going to strip electrons off of molecules. And if those molecules are in your airways, it creates inflammation and bronchoconstriction. So this circle in the middle shows healthy air getting to the alveoli, where the oxygen goes into the bloodstream, CO2 comes out. But if you constrict the airway, cause not only edema, but secretions, you block that, and you limit the ability for the lungs to function. We all kind of know a little bit about what COVID did to us, and COVID affects the lungs in a similar fashion through a different inflammatory method. But the combination of ozone and COVID, we actually have documentation that's a bad combination. So I'm going to go through this pretty quick. Some of these things, it's a little irritating, cough, scratchy throat, but the inflammation and damage is really what concerns me. And especially if you have pre-existing conditions such as asthma, COPD, emphysema, chronic bronchitis. this isn't just for people that are sick. I tend to look at the ozone readings before I get on my bike if I want to go right up up in the mountains. Because if I see a high ozone day, I do not want to be working my lungs really hard on a bike. And one of the biggest things that's of concern is it's possible that this sort of inflammation is one of the initiators of asthma, which is really scary. Unfortunately, in medicine, we have a common theme for things we don't understand called etiology unknown. This may be one etiology that's causing asthma. Bad thing to happen. Not only kind of the minor issues, but the big concern obviously is when you get sick enough to where you're not going to work, the kids can't go to school, you need to make a doctor's visit, God forbid you have to go to the emergency room, and at the top of the pyramid is that last thing called death. I've highlighted in this next little section the top 13 reasons that people come to the primary care folks. And I would argue the ones I've highlighted in yellow can be caused by irritants in the air, ozone, etc. Now, your doctor, unfortunately, is not going to say, gee, how much ozone did you breathe today? Perhaps we should, but it's important to recognize there is a correlation to not only the level of ozone, but your connection to, or not connection, but your location compared to where oil and gas is producing. Andrew did a wonderful job with those flare camera looks, and something you really don't want to sit down and have popcorn and enjoy. But part of this is not just the ozone. And ozone is a combination of multiple volatile organic compounds and nitric oxide. But hydrogen sulfide, 2 weeks or 3 weeks ago, Dr. Danning was presenting, I think, in this system, and he provided an issue where he was at a fracking site, and they told him, if you smell this rotten egg smell, you run the opposite way, you get your respiratory gear on, because that could kill you. So what this really is saying to me is stuff is coming out of the ground that was locked in and not able to interact with our air, with our water, with our ground. And not to go into organic chemistry, but basically these are carbon, hydrogen, oxygen. And guess what we have in our body that is our protein, our fats, the carbohydrates, carbon, hydrogen, oxygen. The proteins have some nitrogen stuck to it. But the concern is these products can get in and interfere with current things that are ongoing. Not only can they be irritating, and that's the kind of the short-term exposure, dizziness, headache, skin irritation, nausea, vomiting, etc. But my goodness, we know these are linked to cancer, linked to heart disease, certainly respiratory problems, kidney, central nervous system. Not listed on here is reproductive issues. And this is, again, a busy slide, I apologize, but again, carcinogenic is a bad thing to have in your air, even in small quantities. One of the things I worry about is we know the lethal level of these items. And that's like, oh, if you walk in a room where there's this amount of benzene, you're in big trouble. But what we don't know is long-term exposure to lower levels. That's we're learning more, things are becoming more clear. There's more and more published. I'll show you some data on that. But the bottom line is we know these things have an effect on our central nervous system, our kidney, our liver, our skin. And again, it scares me with the reproductive system. A lot of the papers that have been written are going to be focusing on fetus development, obviously the combination with the pregnancy, young children, and we know that those are all bad. But again, there's a study I'll show you shortly that talks about the Medicare population and exposure and being in contact with these issues. So here we go. I know that Dr. Helmick's going to talk more on this, so I'm going to be pretty short, but again, back to the American Lung Association and our F rating. On your right, you see the non-attainment since 2007, long time. And Dr. Helmick will show this graph on the picture on the right is from the COGCC. And this is the wells. It looks like a bad case of measles to me, but basically all those little red dots, the ones that are culminating into a solid, those are wells. Not all of them are active, but they basically are the producing wells. And when you look at the two pictures next to each other, I think you can say there is a connection. Other things create problems in the air, obviously tailpipes from vehicles, other industrial issues, but oil and gas is definitely a big part of it. This is the study I alluded to, January 27th, just a couple of months ago. Exposure to unconventional oil and gas development, i.e. fracking, and all-cause mortality in Medicare beneficiaries. In other words, cancer, heart attack, stroke, accidents, anything that basically kills you. This is a huge study. 15 million Medicare beneficiaries were studied over 15 years, and they were looking at areas where there was going to be a higher risk. And I'll show you a map of that. And it wasn't just being close to the facility, but more, but including those that were going to be exposed because of the prevailing winds and downwind pollutant exposure. And the underlying end result is we found evidence of statistically significant higher mortality risk associated with living in proximity to and downwind from unconventional oil and gas wells. So it's not just affecting the babies, the fetuses, the young children, the pregnant women, the people at risk with asthma, heart attack, heart disease, COPD. It's affecting all of us. This was 15 million Medicare beneficiaries. Here's the map that they used, or here's a map of the geographical areas we used. And guess what? There we are. So in this study, I actually hit Medicare in a couple of days. I turned 65. But bottom line is, this is looking at all those folks that are in that registry, in that healthcare insurance, and they found harm. Now, I can't go into all the scientific data, but it is there. I want to make sure if you're not aware of the compendium, please look this up. PSR is probably the easiest place to get it, Physician for Social Responsibility. If you just Google PSR compendium on harms and risks to fracking, you'll pop it up. You can download it. It's 474 pages, and all that's in here are abstracts. So study after study after study. This goes back, I think, 8 years. I don't think the new edition is published yet. But it's a clear indication that not only there's evidence for problems, but it's growing. It's organized and hopefully available to public officials, any researchers, journalists, and the public. And I'll show a link to this searchable database that you can, climb into the actual articles and read them and pull them up and print them if you want. It's kind of scary, but this is something that is real, and it's not just a possibility. We know these risks are there. So in the summary of this whole compendium, the vast body of scientific studies show that this is real, and it causes not only problems for our climate, but for public health. And it's wide ranging. There's no evidence that this compendium has been able to find that fracking can be done safely without threatening human health directly and without imperiling climate stability, which, again, this is what I'm asking my patients and telling my patients: if you're not living in a healthy environment, you're in trouble. Again, we need to do stuff. Now, this obviously is, it's also published by scientists and around the world, but in New York, state of New York has banned fracking. I think all of us, at least most of us that are thinking, would be nice to say, can we move away from fossil fuels to renewable, to other form of energy, and limit the amount of injury that occurs. This is the database. Once again, I apologize, big, long URL link at the top. But if you just look at PSE, physicians, scientists, and engineers, and if you put in Rogers Citation Database, you will be able to pull this up. And in there, you can pull out pretty much any article. There are thousands of articles in there. What I've done here is I've went down to health. I selected hazard risks. These are alphabetically listed. You see a couple of articles by Lisa McKenzie, who's a researcher who works at the CU Anschutz Public Health. Dr. Helmlich's work is published in here. It goes on and on and on. Dr. McKenzie talks about heart defects at higher rates near oil and gas facilities, low birth weight in infants, leukemia in children. So there's scientific data that shows this is a problem. I'm going to focus now, because air is important, water is important, but I'm going to focus not only just on clean water, but the fact that we don't have a lot of water in this area. In this little picture here, the Pennsylvania average well uses 4.4 million gallons to frack. Now that may be a couple of days, and that well may be fracked over years, maybe decades, but that's a lot of water. And to put it in perspective, 4.4 million gallons of water is what 11,000 American families use in a day. Now, to take that now, here's the other end of the spectrum. This is in the Texas Permian Basin fracking well. Their average is 10 million gallons of water to frack. Lots, I mean, I can't even wrap my brain around it. Almost 16 Olympic swimming pools just to frack. And here's the problem. Once that water, which is about 80%, 85% potable, meaning it's drinkable, once it basically, the chemicals are added to it, perhaps they take some old fracked water and add to it. Once that goes down into those pipes, into those systems, it really cannot be used. I would never want to have that in my tap water. Now, when you flush your toilet, when the shower, when the water, that water is, it's not simple, but that can be cleaned up at our water treatment facilities. Lots easier than this stuff. This is almost unusable, and it probably is unusable forever. This says there's one exception, but you kind of wonder what good enough means, and if you're going to be putting it on crops or giving it to animals. It's just, again, kind of concerning to me. Most of this water is being injected back into empty wells. Got to worry about seismic activity. You got to worry about leakage into aquifers. I mean, there's all sorts of things I worry about. So not only is there the argument that water is scarce here, but we're destroying potable water. And it's just doesn't make a lot of sense. Getting right to the end here, each year, the Groundwater Council estimates 3,400 billion liters of produced water is what's coming from oil and gas. Now, what does that mean? Well, I did a little math, and it's essentially about 900 billion gallons of water a year. And again, to put it in perspective, it's the annual water. In other words, what a family would use in a year. But that's enough for 6 million families. I get it. There's energy down there. It's nice to be able to pull it up, but look at the cost. Look at the human health cost. Look at the environmental cost. Look at the damage that's coming out. So I kind of worry as a physician, what's happening to my patients? Many things that they're exposed to, I don't know. I have begun to ask, where do you live, and try to see if there's association, especially when I get into some difficult patients where I can't understand why they're sick. The evidence is overwhelming. People will tell you, oh, this is not a big deal. I disagree. And the evidence is increasing. We're getting, I think, to a point, as Andrew pointed out. I don't want to say we're out of time, but we need to do more for our health, for our children's health, for our elders' health, and for the planet. So with that, I will end, and I thank you for your time, and probably would take questions at the end so we can move on, or I'll leave that to Sandra.
Thank you, Dr. Carroll. We do have just a couple things that we can address now, and folks, please feel welcome to continue to ask your questions for Dr. Carroll or any of our panelists. It's what you said definitely resonated with folks in attendance, lots of exclamation about our air and water and how it's impacting us all. And I think the majority of the conversation on the chat was dominated by how could this be happening, given the fact that we know this information. So I'm wondering if you have any insight on the disconnect between all of the available information and the lack of policy to address it from the state and local, at the state and local level.
I'll just try to be very brief. I think we don't know that much about it. I mean, a lot of these things have been flying under the radar. Dr. Helmig will go into his research. But honest to God, I bought a gas stove 5 years ago, and I'm beating myself up going like, what was I thinking? Well, I just didn't know. And I think, let's face it, the oil and gas industry calls this natural gas. Come on. They're brilliant at marketing. They've been brilliant at hiding. They've been brilliant. They've taken the playbook from the tobacco industry and tried to shift this to say, oh, it's not that big a deal. It's not a problem. I think with the compendium, with more states, with more countries coming out against this, people are starting to go, wait, what is happening? It's almost, 1963, the Surgeon General said, hey, smoking cigarettes is bad. The American Medical Association, who got a $10 million gift from the tobacco industry, didn't quite agree. So there's a lot of politics, there's a lot of dynamics, but we're here to tell you this is real, this is a problem, and it's fixable. I think at least it's manageable. So that's the best I can come up with. It's people not knowing, and then the industry doing a great job at hiding.
Thank you. I know we're at the beginning stages of learning more about this, and hopefully we're also at the beginning stages of the tides turning in terms of policy. So thanks for addressing that. Another question we received that hopefully you can answer at this time is regarding personal mitigation. So given that the state and the industry aren't in a rush to reduce emissions, what can folks do to mitigate their personal risk? Air purifiers, limit outdoor activity, any recommendations?
Sure, there are sites, I can't quote them right off the top of my head, but they can tell you what the air quality is. Now, I'm really excited to see Dr. Helmig's work expand and learn more about what is in our air. But look at the particulate matter, look at the ozone, look at the sites that will give you that data. If you see a high level, avoid, if you've got asthma or COPD, don't do anything. But if you're going to go out for a jog or a ride, don't do that in bad weather. I think the other thing is just continue to push our elected officials to be aware of this and make sure that we are doing as much as we can to protect ourselves. There are some filters that could help. There's a lot of debate on the monitors, whether or not they can tell you everything you need to. That's a whole nother lecture. But I think be aware, and it's not the end of the world, but there are days where I will say, I'm not going to go exercise today outside. I'll stay inside. And if it's a bad day, inside's the best place to be.
And if you are within 2,000 feet of an active frac site, almost every day is a bad day to exercise near that. So I'll add that being conscious of your location in terms of where well sites are, whether they're producing or drilling or fracking is also important. And you can find some of that relevant information on the COGCC website. Thank you, Dr. Carroll. That's all for immediate questions from you. And we'll hopefully have more questions that you can help us address at the end of the webinar. So at this time, we're going to be welcoming our third panelist, Dr. Detlef Helmig. He is from Boulder Air, and he will explain how sophisticated air monitoring devices can identify, quantify, and to some degree, address the source of pollutants.
Yes, hello everybody. It's good to be here again. I hope you can see my screen now. So yeah, I was specifically asked to emphasize in my presentation today the benefits of continuous high resolution monitoring, since there's been an interest for a while to expand the current operation of these monitoring systems into Larimer County. So that's what I'll be focusing on mostly. So let me walk you through my presentation. Oops, I have to go on this screen. There we go. This shows the currently in operation monitoring network in the Northern Colorado Front Range. This is a brand new map we just posted. All these colored dots here on the right show you where there are monitoring sites. They're tabulated on the left. So altogether, there's 9 altogether right now, operated by different municipalities. You can see they expand from northern suburban Denver, actually it's Commerce City, to Longmont. So the Longmont sites currently are the furthest northern locations where we maintain this monitoring. If you go to this website and you want more information on these sites, what you can do now is pull up this map, hover over these different colored dots, and it will pop up on the left side information on these stations, a picture, a link to the particular website, and it also lists the number of measurements. So in this case, this highlights the BSE, that's the Broomfield Soaring Eagle location. And you can see on the left, currently there are measurements of meteorology, ozone, volatile organic compounds, nitrogen oxides, hydrogen sulfide, particulate matter. So this is one of the largest stations that's currently being operated. That's how these sites look like, and most of you have seen this by now. 8 of these are in the Front Range, so small instrument shelters and several occasions those are instrument trailers that are somewhat mobile, can be moved to other locations if there's a need to mobilize those to different neighborhoods or other areas where there are concerns. Well, this shows the locations of the currently operated site. On the left, again, these colored dots. On the right, you've seen this map before. That's the distribution of the oil and gas well sites in the larger Front Range, all these brown dots. And these maps show pretty much exactly the same geographical area. So you can see that the network that we operate right now expands from south, outside of the oil and gas region, and then mostly on the southwestern flanks. If you go further north to Larimer County, Fort Collins, currently we do not operate anything similar there. There's some ozone monitoring by the state done in Fort Collins. And as I've shown in several presentations before, what we're seeing in the Front Range pretty typically is a flow pattern during the day that brings air from the east to the west. And we see that very clearly in our network data. So from that behavior and understanding that we have now, it's quite probable that the communities north of Longmont, Berthoud, Loveland, Fort Collins are similarly subjected to outflow from Weld County and exposed to plumes with oil and gas pollutants, which I will show in many of my following slides now. Again, you know, we use equipment shown on this slide here that's research grade, regulatory grade monitoring equipment that provides high precision, high accuracy monitoring. Whenever possible, we follow regular protocol so that our data are at par with EPA or CDPHE quality requirements and calibration scales. And then the other important part I want to emphasize today is that all this monitoring is continuous, around the clock, and continuous with high time resolution. So these data are typically collected at 1 minute to 1 hour increments, giving us very high resolution data, and I will show many of these data products next. And besides the real-time monitoring, this information is also provided to the public in real time. So there's very little delay on the scale of a few minutes from where the data are acquired to where they're presented on public websites, so that anybody out there who's interested in air quality has access to this data in real time. And this shows 5 screenshots of these portals, these web portals, where these results are presented. From the top, that's the Longmont website. To the right, it's the Boulder County. In the middle to the left, that's the Broomfield website. On the right in the middle, that's the one from Erie. And at the very bottom, that's the very newest one that reports the data from Commerce City, from 2 sites in Commerce City. So continuous monitoring, high time resolution monitoring. So I will emphasize that over and over today, try to instill you the appreciation for that. This shows for just one example, randomly picked. Well, it's actually just from the last 3 days at the Longmont site. So you see the dates, March 13th to March 16th. That shows methane recorded at the Longmont Union Reservoir. And what's remarkable here, and we see this very, very regularly, is the very quick changes in concentration. So you may know methane is one of the main releases from oil and gas operations, the primary component of natural gas. And what you can see, there's a background in the air of about 1.9 parts per million. So that's close to the 2 number here on the left. You can see, whoa, it can go up to 5 times that very, very quickly in a few minutes, and then come down again very, very quickly. So it's very dynamic. And these concentration changes, sometimes they just last 5 minutes, 10 minutes, 15 minutes. So it bounces up and down as these plumes with enhanced oil and gas concentrations transported over the terrain. You may encounter one for a moment, and then it may be blown to the north or the south. It misses the station, and then maybe back a few minutes later. So that very much reflects what we saw in the flare images before. The nature of this pollution is mostly contained in plumes, and depending on how close or how far you are from the source, these plumes can be more narrow or wider, and the length for which you encounter these plumes may be very, very short to minutes, hours, sometimes could be several hours. So we do this continuously. So you can see in this concentration plot, there's measurements every minute. Another approach that you may sometimes see out there is collection of samples in containers. And you may have heard the term canisters, and I have a picture of a canister here. And that's very, very different. In a canister, you take a snapshot, an instantaneous sample that you then carry to a lab and run it on an instrument there, which gives you basically one data point. One data point versus hundreds or even thousands. Compared to this continuous monitoring. And what I would like to indicate here is, when do you take this snapshot? There are different ways for doing this. You could manually open one of these canisters, collect a sample. Some of those are activated by triggers. And depending on where the trigger is set, you don't quite know where in the spectrum you are. Is it triggered, at the first bump, the second bump, the third bump? Really, really hard to tell. So these trigger canisters will take one single sample, one shot, and you will not have information what the levels were prior to that sample or what it may have been after having collected that sample, as you will need to bring somebody out to the site and replace that canister and put a new one up to be ready to do your next sample. So it's a very, very different approach that gives you very different type of information. To contrast that, again here, I've just looked at a few of the parameters, features, comparing the continuous sampling, which is on the left side, and you see a picture of one of the instruments that we operate, versus this canister sampling on the right side. So in the case of volatile organic compounds, for the canister, for the continuous, we typically collect at least a sample every hour. For the canisters, you have to bring in a canister, and maybe once a week, something like that. That results for 8,000 to 9,000 samples with the continuous sampling canisters, maybe 50 to 100, something like that. The cost per sample is much, much different. An instrument that runs continuously provides you much, much lower rate per sample versus the cost you encounter for the canisters. But now bear in mind, we're taking thousands of those over a year. So do the math. Typically operation of a continuous system, you depending on for how long you run it, if you run it for a full year, you may ramp up $100,000 running it for a full year with a continuous sampling program versus with a canister, you could get away with just one or two, depending on how much you want to invest. So there's certainly a cost factor that's very different. And then down this table, you see lots of pluses on the left, very few on the right, and I'm going to show you several examples of those. I want to emphasize that many of the analysis that we conducted and many of the lessons we've learned is due to this very high time resolution, abundant data, as this is the high number of data points, but also the resolution that allows us to do wind analysis, plume analysis, and I will show you a lot of that, correlation analysis, and so forth. And very little of that you can do with canister sampling. Give you a few more examples. This is just a month ago. Again, methane data from the Longmont Union Reservoir. So on top, this is the 2 days of methane. You can again see, it goes up and down, and there are several pollution events there, plumes, and then below is the wind direction, and at the very low bottom, the wind speed. Now, what happened when these plumes occurred? So I'll line up these data here, and what's important to note, and this is a very, very consistent feature we see in Longmont, is these plumes, if you look at those three peaks in the trace below, they all coincide with wind direction right around 90. The first one is right on 90, and the second one, the air was moving from south to the east, so 90 is east. And the third one, it was a little bit more inconsistent, but again, wind direction was around 90, which is east. So most of these plumes, the methane plumes at the Union Reservoir, we see in air that's transported from the east or the southeast, transported over the reservoir. So with this frequent data, we can establish these associations of pollution occurrences with wind direction. That allows us to generate these pollution wind roses. This is an example from Boulder Reservoir that shows in this color spectrum the concentration patterns depending on the wind direction sector, and you can very clearly see these enhanced levels of ethane in this case, which is our favorite oil and gas tracer when air is transported from the oil and gas production regions. Another analysis we can do with this data is to look at the dependency of concentrations at wind direction and wind speed. So what this does here is in this color scale, the more red, the higher the concentrations. It looks at, what were the concentrations in benzene. And you can see there's this true predominant sectors to the northeast and to the northwest, where especially at lower wind speeds, we see elevated benzene, whereas winds from the southwest, the southeast, even from the direction of Denver here, we see relatively lower levels of benzene. And to put this in perspective of the site characteristics, here are the same data, and it shows the location of this monitoring site. This is the Broomfield North Pecos monitoring location, which is where the star is. On the left, it shows these analysis results for ethane, our oil and gas tracer. On the right side is benzene. And it shows you the 5 active oil and gas drill operations that have occurred over the last year or so in that area. And we can nicely see how these elevated benzene plumes have passed over 2 of the well sites that have been actively developed during this time period, which are the Northwest and the United pads. So this data allows you very, very nicely to make this association of what's upwind, where has the air traveled from, and what sort of operations, activities have been in that direction. We like this so much. I have a few more examples, different sites, different pollutants. This is very novel. This shows hydrogen sulfide, and we heard about this a little bit already. So this is this rotten egg smelling gas that we really don't appreciate. And if you've driven down, this is 270, near the Suncor refinery, you've probably smelled this yourself. And this shows a very distinct source sector for this elevated hydrogen sulfide, very narrowly defined wind direction to the southwest, whereas air transported all from the west, from the north, from the east, really doesn't show this. So it very nicely allows us to pinpoint in which direction this hydrogen sulfide originates. Another nice story for this analysis approach was identification of acetylene releases from the Livingston pad in Broomfield. Here we actually were lucky because we had 2 monitoring sites, one that was to the west, northwest of the pad, which is in this circular red marker here, and then the Soaring Eagle side, which is to the northeast. And doing this analysis, we could show that both of these data sets consistently showed that this elevated acetylene was in air that had passed right over the Livingston well site. Another type of analysis, instead of associating these concentration readings with wind direction, we can use what's shown in this little inset on the left, what's called trajectory. So that has nothing to do with wind. It's based on weather models that track where the air has traveled from. And when we associate these high resolution data, it's basically take a data point every hour, and look at the path the air has traveled, we can identify these source regions of emissions. This is an example from the Boulder Reservoir that shows then on the right side in the red colors where most of these emissions occur that are then observed in this high resolution data at the Boulder Reservoir. So a few other aspects of the ongoing monitoring program I want to point out is one of the benefits is the multiple sites we have now, which allows you to evaluate and compare observations at a particular site with the behavior in the larger regions, which is extremely valuable and has really taught us a lot in identifying, what are local sources and what's the regional behavior. And there's several examples here. Let's go down from top to the bottom. The top shows ozone. Ozone is a regional pollutant. You can't really run away from it. It behaves very similarly across the Front Range. And right now, these are data from, again, just a few days ago. We are not quite in the ozone season yet, so ozone is pretty moderate. But then the next step down, this is methane, and we've seen this several times again already, showing that the purple data, that's the Union Reservoir. We see quite an abundance of methane plumes there. Similar with ethane, our oil and gas tracer, you can see that the Union Reservoir had the highest peaks there over the last 3 days. Nitrogen oxide, it's a little bit more evenly distributed, but interestingly also there, the Union Reservoir, we've seen this throughout the year, has relatively high nitrogen oxides. At the very bottom, though, that's a different case. For when it comes to particulates, what we've been observing there the last months is that we get quite an abundance of elevated particulates reading at the Erie Community Center, which is likely caused by construction activities that have been ongoing near that location for quite a while. Again, more comparisons here. This is now 2 years of ethane data from the 6 sites that are now in operation. The ones at the bottom haven't been running all that long, but you see some of the data coming in here. Very interesting differences. Compare the Boulder Reservoir at the top right with the Union Reservoir, and these are all scaled to the same y-axis scale, so you can clearly see the much higher frequency and much higher peaks of elevated ethane observations there. This is the hydrogen sulfide case again. There we have a second comparison site in Broomfield. You have to look really, really closely to this graph at the bottom. In blue, that's the data from the Commerce City site, and the green data are from Broomfield. We see how they contrast, where the Broomfield data, the green, are much, much lower, much smoother, almost no occurrences of elevated hydrogen sulfide, whereas in Commerce City, you have these elevated occurrences over and over and over very consistently throughout this 2 weeks window. And that's the example again with the particles. I mentioned it earlier. The yellowish color showing the Erie Community Center, where throughout the winter we've seen a much higher abundance of particulate pollution. Now, it's also asked to point out, how does this relate to evaluating compliance with air quality standards? So what I've done here is I pulled together air quality standards as they are currently being observed. And so this lists in this table ozone, carbon monoxide, nitrogen dioxide, particulates, and sulfur dioxide. Those are the ones where we have national ambient air quality standards. And for all of them, the compliance is evaluated through observations of continuous data. You cannot do this with just spot sampling, so you have to monitor this continuously, and the data are evaluated depending on different averaging intervals, which are also listed here, and they may vary from 1 hour to a full day of observations. We're often asked, when the what conditions do we exceed air standards for methane or VOCs? But there aren't any. There's currently no enforceable or observed national ambient air quality standard for methane or VOCs, or not even for benzene. So with that, I'm getting to my last slide here. Summary. I want to point out that this whole monitoring is supported by local governments, not by the state, not by the EPA, and they're listed here: Boulder County, City of Longmont, City and County of Broomfield, Town of Erie, and then also Cultivando, a community organization or group in Commerce City. And again, the map with some of the highlights. And with that, I'm happy to, well, that's it. So I'll be happy to entertain any questions you may have. Thank you.
Thank you, Dr. Hemlich. I think since we are running towards the end of our presentations here. There was lots and lots of questions for you, but I'm going to go ahead and save them for now until the Q&A portion in just a few minutes. But right now I want to introduce Gayla Martinez with the Larimer Alliance for Public Health, and she is going to give some concluding statements.
All right, thank you. We hope that you've learned something tonight and that you will be motivated to join us in taking action to promote the transition to air that is pure, pollution-free, and life-sustaining. Now, I'm going to give you some suggestions for things that you can be doing. There have been lots of comments in the chat from people that are interested and are wanting to be active. So I'm going to give you quite a few here that you can choose from. So I'd like to ask you to be ready. We have some QR codes on some slides, as well as links in the chat. So if you want to have your phones ready to be able to capture those. First of all, we have a sign-on letter, and we'd like to ask people to sign this that calls for the City of Fort Collins, for Larimer County staff to research what would be needed to set up a comprehensive real-time air monitoring station similar to those provided by Boulder Air to be operated under the authority of the City of Fort Collins or Larimer County. Some of you may want to express your own thoughts to Larimer County Commissioners or the Fort Collins City Council. And we are also going to be providing a slide that has email addresses on it for that. Both Colorado Rising and Larimer Alliance would encourage you to go to the respective websites, and there you would be able to sign up for email updates from each of those organizations. Also, we have a slide here that will allow you to use a QR code if you would like to make a donation, either to the Larimer Alliance or to Colorado Rising. And I'm going to turn it over to Sandra just for a minute to also explain a little bit about a special project that they've been working on.
So one of the, can everybody hear me all right? One of the things that we've been working on, hopefully we'll start to work on more and at Colorado Rising, is a potential air quality app. As our air quality along the Front Range continues to degrade, we are seeing more and more communities express interest in the use of an air quality monitoring app to detect these toxic emissions and to track and monitor patterns of pollutants. However, the community, from community feedback, we keep hearing a common complaint that the data is very hard to understand without technical or scientific expertise. One solution to this problem is to create a regional air quality monitoring app that connects data and results from all municipalities participating in local AQM programs such as Boulder Air. The app will include a technology-based 3-phase solution that identifies the air quality in real time based on the user's location, allows users to submit complaints, and offers the option for users to receive mobile air quality monitoring alerts. So that's just a little something about what could potentially be in our future. Hopefully that addresses some of the questions about how we can address some of these problems as private citizens. Now I'm going to run through a few closing slides that have some pertinent information. And after that, we're going to open the Q&A for our panelists here and Larimer Alliance so we can address some of your pending questions. Thank you guys all for your time. We really appreciate it. So as Gayla mentioned, there's a sign-on letter that was drafted by Larimer Alliance with the help of Colorado Rising. The letter is intended for the commissioners at Larimer County and Fort Collins City Council to help them see what we're all learning about today and hopefully get to addressing the problem at the local level in Larimer County. So if you want to learn more about that, you can scan this QR code that's on your screen. Kate will also drop a link in the chat so that, or has already dropped the link in the chat so that folks who are more comfortable can click on that and they'll direct you to the sign-on letter. If you want to get more involved with either Larimer Alliance or Colorado Rising for Communities, you can go to the following links. We, like Gayla said, we have some info alerts that we can send out to keep you in the loop and keep you involved. If you want to share your concerns directly with those that in power in Larimer County, you can email the Larimer County Board of Commissioners or the Fort Collins City Council with your thoughts. I know that a lot of us have learned a lot this evening, and we want to make sure that those who are in power are also educated in regards to what's in our air and what should be done about it. And further, if you are interested in contributing to either Larimer Alliance or Colorado Rising's mission, we are always accepting donations. And those donations go to further our efforts to educate the public and to fund things such as community-led events and potentially our air quality monitoring app and other upcoming projects that we have. So thank you guys all for attending. If you want to, you're welcome to log off at this time. If not, you can stay for our Q&A portion. We're going to ask some of the questions that you guys have been asking on the question and answering box and also via chat. So I invite our panelists and those folks from Colorado Rising and Larimer Alliance to stay logged in so they can help us address some of these questions. All right, well, let's get to it. We have some questions that are directed towards specific panelists, and then we have some questions that I'd like to open to the entire panel. So even if there's a question that's directed towards a specific panelist, if you would like to help address it, we are more than happy to allow time for you to speak. We're going to stay on for another 10 or 15 minutes, depending on how we feel about timing. So the first question I want to ask, the first questions I want to ask are probably mostly for Andrew. One question that came up is, how does the OGI camera compare to a FLIR camera?
So FLIR is a manufacturer of OGI cameras. So when you say FLIR, it's like saying Kleenex for tissue. The OGI camera is the tissue. Kleenex is the manufacturer. FLIR is the manufacturer. OGI cameras are just a type of camera. So optical gas imaging cameras have other manufacturers. FLIR is one of the main manufacturers. So same shorthand. Many people say FLIR because it's the manufacturer, but we use optical gas imaging camera because there are other brands of camera.
This question can be for Andrew or for anybody on the panel. I'll go ahead and start answering it. So who inspects and enforces proper function of wells? And I will say that the majority of these inspections are led by are supposed to be managed by the COGCC. And if I'm correct, a lot of those inspections rely on self-reporting and self-inspecting by the industry. Is that right, Andrew?
Yeah, so I mean, if the question is inspections in general, operators are required to inspect their own facilities at a certain frequency, depending on the size of the well. So lower producing wells only have to be inspected annually, larger wells quarterly, or depending on the production level, size of the pad, you have different levels of inspections that are required by operators themselves. In response to a complaint, it depends on the complaint. It can be the Colorado Oil and Gas Conservation Commission, especially if it's something to do with the site itself or concerns that community members have about noise or odors or impacts like that. I typically file complaints directly with the Air Pollution Control Division, and then they will follow up with their own investigations because they are the agency that gives out air permits. And so air pollution violations technically fall under their purview. Although at times I will file simultaneously with COGCC and APCD. But so there's a variety of different inspections that can occur. But in response to complaints, it's either going to be the Colorado Oil and Gas Conservation Commission sending out an inspector or the Air Pollution Control Division.
And along with that, someone asked, if there's a standard it seems that a simple standard to require is that all sites have those cameras and other direct measurements equipments installed for continuous monitoring. Has this ever been proposed?
I mean, I don't know if it's ever been proposed. It's not something that occurs right now. Newer facilities in pre-production phase, so some of these new fracking pads that we've seen going in the last year are required to have monitoring up through the first 6 months of production, but that's not visual monitoring like what you'd get with an OGI camera. That's canisters or sensors that are placed around the pad. As far as I know, and I don't know if Dr. Helmig knows of any, I don't know of any pads that currently have any continuous monitoring that includes something like an OGI camera, like a visual component. That's not something that I know of being employed to monitor these well facilities.
And we mostly think that's because the industry feels like their measures are sufficient, even though we know they often aren't. But they're not particularly motivated to add additional monitoring devices if they're not pushed to that extent. Regulators can get better access to the oil and gas sites because of the LDR inspection capabilities. Andrew, can you talk about how helpful this is because they can get much closer usually?
Yeah, I mean, so in general, this helps them detect smaller leaks. So, one thing I like to tell people, and, going back to my slide in terms of, the number of surveys I conducted versus the complaints I filed, I find that percentage disturbingly high. That percentage would be much higher if I could get closer to facilities. I'm only able to see major emission events or large amounts of pollution that are coming off of these facilities. I can't find or detect a small leak from a pipe or a small leak from a valve because I can't get close enough. So, state inspectors, an operator who's doing a proper inspection themselves will be able to detect smaller leaks. But it's just a caveat that I like to share with the data that we're able to collect, the videos that we're able to show. As much as I am able to easily find pollution, there is probably much, much more that's going on that I cannot see because I can't get close enough to the equipment to see it.
There's another question about whether you're the only person, or not the only person, but is Earthworks the only entity that is doing this type of work? And if so, why are there not more people keeping an eye on the oil and gas industry?
Well, as I said, we're the only nonprofit environmental group with access to this technology currently in the state. There are some groups do flyovers with OGI cameras, so they'll fly over in a region and look at, and that's happened a couple of times in Colorado and in Texas as well. EDF has sponsored those sorts of things. But the state inspectors at the APCD and the COGCC also have these cameras. The operators themselves have these cameras. But we're the only ones who take the videos that we record and put them on YouTube and let the public know what's actually going on.
And I would like to add that Earthworks works not just in Colorado, correct?
Yep, we have people like me in Texas, New Mexico, and Pennsylvania.
Awesome. I want to move on to some questions that are specifically for Dr. Carroll. One question that was asked in various forms was if there's any kind of air purifier or air monitoring system that you would recommend, residential stuff that folks could get themselves.
I do not have any evidence that there's anything out there that would clean the air to a level which would be safe. I mean, there may be some issues. As far as the monitors, I think that's out of my spectrum as well. Dr. Helmig may be able to move into that. I do think that, again, if you're inside your house and you have the windows shut, that's the best way to mitigate environmental exposure. I kind of joke, and I think in the 1970s, Colorado passed the Indoor Air Quality Act, which was for secondhand cigarette smoke. And I think it's time we have a legislation to pass the Outdoor Air Quality Act and create a similar process to say those that are contributing to this pollution need to stop. The hard part of that would be, okay, that means they can't operate. And, Senate Bill 181, which was passed in 2018, 2019, gave a brand new look at this. And that's why I think oil and gas is scrambling. But it's hard to change old behaviors. It's hard to change everything. But unfortunately, to answer your question, I can't say there's anything I'm aware of that would purify the air. But if you're aware there's a bad day, get inside, shut the windows, and don't go out.
Thank you. And as a resident who is particularly close to 26 wells, I can tell you that I don't have any evidence, certainly not more than Dr. Carroll, but we have an Austin air purifier and several Blue air purifiers in our house. It just for peace of mind. And I know that there is some residential air quality monitoring devices you can install in your home. And there's even a residential VOC detector by Purple Air that one of our neighbors has. I don't know how reliable that is. Dr. Helmig can address that, but the options for monitoring these pollutants are really limited at the residential level. That's why we need state-of-the-art equipment like Dr. Helmig's to help us see what's in our air. Thank you, Doctor.
I wouldn't invest much time and energy into these residential VOC monitors. I haven't seen convincing observations that would give me confidence that the observations from those are going to help you with your questions. I think they may cause more questions, more concern, more worried for false reasons that I wouldn't direct you that way.
I agree. And I would think that the best way forward would be to make reliable data like Dr. Helmig's more readily available to the public. If you have, sorry,
Can I just add on real quick? I think I saw a quick note in the chat. Most of us are burning fossil fuels in our house. So these volatile organic compounds, especially if they're not completely combusted, that's why we have CO2 monitors in our homes. I mean, how nice would it be that we don't have to monitor for air pollution in our homes? So the argument was like, gosh, if you shut your windows, then the VOCs in your house will build up. And that's true. But that's where I think having adequate venting, make sure, if you have a furnace that's burning gas, make sure you get people to come out and make sure it's venting correctly. Make sure you have good vents for your gas stove. If you turn your gas stove on, turn the vent on before you turn the gas stove on. Move away from fossil fuels when you can, but the whole hope is that we move into an area that we are burning less of this system, and even in our homes, and pulling it out of the ground. And that to me is the best solution, not monitoring it and so on and worrying.
Thanks for that clarification, Dr. Carroll. I know as a resident who can't afford to move away from these 26 pads and also can't afford to get rid of my gas stove right now, air purifiers do give me some peace of mind. They're not perfect, and we don't have solid proof that they do much more than give me peace of mind. It's not a permanent solution, but if you, like me, have invested in a residential air purifier and you have a recommendation for folks that are asking, please do drop that in the chat so folks can do a little bit more research about those if they're interested. Dr. Carroll, another question for you that came in various different formats was regarding medical conditions that are impacted by things like fracking. So dermatitis, asthma, if there's any information you can provide about specific conditions.
And again, this is going to be proximity, it's going to be exposure downwind. The obvious is going to be respiratory. So as I pointed out in the slide set, if you have asthma, if you have COPD, emphysema, same argument, this is going to make those conditions worse. So be very cautious. Your skin is exposed to the air. Your eyes are exposed to the air. You breathe in through your nose. So many complaints are going to be irritation of the nasal passageway, runny nose, sinusitis, posterior pharynx is pharyngitis. So yes, the clear thing with ozone, it's an irritant. So whatever it's going to be exposed to is going to create problems. Our bodies are designed to protect ourselves, and anything that gets in the way is going to create increased secretions, again, bronchoconstriction and that. So Yeah, the fear I have or maybe not the fear, but the frustration I have is that I think a lot of the conditions that people present to their primary care doctors and the urgent cares and ER do not ask the question, could this have been mitigated or could have been caused by a low-grade exposure? And as Dr. Helmig's data pointed out, you'll have these spikes and these plumes. And my fear is when you're exposed to these over a long period of time, years, that can actually build up and create more and more problems. So the answer to the question is there's many issues. I mean, the most severe is going to be when you move into the reproductive system. You have endocrine disruptors that are part of these chemicals. And it's not just oil and gas. I mean, it's plastic, it's the tailpipe emissions. And again, what we have to be aware of is that our bodies are these amazing chemical factories that can be influenced. And the best thing is to understand that, find the best way to mitigate the exposures, and then implement that, even if it means we need to create a whole new world of our energy creation. But I wish I could, say, here's a safe place, here's a safe filter, here's a safe that. It's frustrating to me living in Fort Collins that we have this issue. It's not unique to us, but it is very prominent here. And we need to do more than just, I love the continuous monitoring. I think that makes more sense, but we need to do more than just demonstrate the problems. We need to act on the reasons they're there and quickly.
Thank you, Dr. Carroll. A couple questions specifically for Dr. Helmig, and then we'll move on to some overarching questions. I know there's lots of folks here from specific communities that are wondering what we can do about this, and we'll get to some of those questions next. But for Dr. Helmig, one of the questions that was asked in various ways was, what is the cost of continuous monitoring devices such as Boulder Airs?
Yeah, I was wondering, you get that. So we kind of have, like a shopping list. It very much depends on, which variables you want to monitor. I showed we showed earlier data for ozone, for methane, there's nitrogen oxides, there's particles, there's hydrogen sulfide. And you saw that, for each of these different species, you need a different instrument, you need a different calibration system, you need to collect the data, you need to process it and so forth. So, it goes up with the number of species you're monitoring. The less costly ones are ozone, particles, and then the methane gets more expensive, and the VOC is about the most expensive. We're doing radioactivity now as well. So we have a table. I'd be happy to share that. And we've been, all these communities, everything you've seen, and they're all the same rates for everybody. It's just, ordering something online from Costco. And typically we have a higher cost for the first year, since acquiring the instruments and setting everything up and getting a station established is a much higher effort than keeping it running once everything is in place. So, it can go from one of our cheaper sites that has just a subset of monitors, runs in the order of maybe 150,000 a year right now. The larger ones, it could be double that if everything that you've seen on that list is included. So yeah, that's roughly the structure of how that billing works.
Thank you. Can you draw a line, or could we draw a line to connect the dots from installing a Boulder Air type equipment and reducing pollution?
Well,
I know that's isn't that the question of the hour?
I'd like to believe, it makes a difference, and I think it does. It does, and we have many examples already where our data has pointed to emissions, and it has created awareness, either for citizens, but also for city agencies, counties, who've then followed up and approached operators. And with having that data in their hands as evidence, helps then helped to change operational procedures and brought emissions down. I think with this whole network we've developed, there's been an immense increase in awareness of the type of pollutants, the behavior of the pollutants, of what's causing ozone. We've showed clearly ozone is mostly from here, or the ozone that's making things bad. It's mostly because of what's added here regionally, and that has helped stimulate some of the regulations we've seen that have been enacted and passed over the last couple of years. So I think there's been a benefit from an individual side, but also, the combinations of the different sides that have us allowed to pinpoint where pollution is coming from, where is air cleaner versus where is air more polluted, where the hotspots of emissions. Our knowledge, our understanding of the causes of air pollution have really evolved immensely over the last 2-3 years. And I think, that there's been a clear benefit, and there's still new regulations being drafted, and I think it will continue the more we learn along this path.
Thank you. And then one last question for Dr. Helmick. How important would you say it is for Larimer County to adopt air quality monitoring equipment such as yours, or other places across the Front Range? Is having the monitoring linked together helpful?
Yeah, well, we were pretty happy and proud with the first station at the Boulder Reservoir, and we learned a lot just from looking at that data. And then Longmont added 2 stations, and I was surprised, and Longmont was surprised how many things were different. But just the gradient. That's just, that's 15, not even 20 miles distance, and I showed some of these comparisons. Some of the primary pollutants, the primary emissions, are much higher in Longmont than what we see at the Boulder Reservoir, and we didn't know. We didn't know. I would have guessed that it might have been higher, but would I have guessed 20%, 50%? And it's the spikes in the frequency we see is much more than that. So you really don't know for sure until you've really been there and looked and collected the data. And then when we added Broomfield, we're wondering what's going to be different in Broomfield. Are we already doing this in Longmont? But again, we saw new features in the data that we never anticipated. These emissions from the Livingston Well pad. We saw a new pollutant, acetylene, which we hadn't seen at the Boulder Reservoir, which we hadn't seen in Longmont. Right now, we're just a couple months into monitoring in Commerce City, and we're seeing these hydrogen sulfide levels we had never anticipated. We were wondering, is the hydrogen sulfide because of the obvious odors and odor complaints, but we had never anticipated that it would be this abundant, that these spikes would be that frequent and levels would be as high as what we actually see. So I would say each of the sites we've taken on has revealed new information, important information about air quality issues that we didn't anticipate. Now, looking into Larimer County, we do know that the Fort Collins State ozone monitoring sites record among the highest ozone in the state. Fort Collins West, and then I think there's the downtown station as well. So that's very well known. That's consistent for years and years. We've seen that. We've learned over the last 2 years that especially in the summer, the flow regimes here in the Front Range are such that from mid-morning to late afternoon, we get overwhelmingly flow from the east to the west. So we see the emissions from Weld County be transported towards the mountain slopes, and at times get trapped against the mountain slopes and see elevated ozone. The highest ozone in the States is observed at the sites right along the mountain slopes. So yeah, and Larimer County falls right into that regime. We don't know a whole lot yet about the occurrence of ozone precursors. We know it all the way to Longmont. Longmont, surprisingly, has the highest NOx, which we also didn't quite expect. I would have thought that Broomfield, closer to downtown Denver, with higher populations and more traffic and power plants, would be higher in nitrogen oxides, but it's not. We see a higher NOx in Longmont. So how does that continue going further north from there? We don't know. There's no nitrogen oxides monitoring north of Longmont right now. So it's hard to predict. There have been surprises everywhere we've gone, and we've learned something new and important everywhere we've gone over the last 2-3 years.
Thank you, Dr. Helmick. There's power in knowledge, that's for sure.
I'm just going to throw in there, I know Dr. Helmick's not going to toot his horn, but living in Fort Collins, I absolutely agree. I've been very a strong proponent to have continuous air monitoring, and being able to link it, I think would be a wonderful addition. As a physician, I love to have data. If I'm trying to take care of a patient, it's good to know what their white count is, what their renal function is. If you don't measure, you're in trouble. But there's things that we know are bad. But for those that haven't signed the letter, for those that haven't contacted the city council, please do so. Please remind them we have this linkage of data set up. And I know Dr. Helmick is not trying to manufacture business, but this is valuable real-time data that everybody can see. For those people that are worried about what's going on, this is another piece of the equation you can look at in your neighborhood and help you assess what to do and where to go, and hopefully move the needle to where we're going to create change and improved health. So please, again, continuous air monitoring is absolutely critical here in Fort Collins, Larimer County.
Thanks, Dr. Carroll. I want to be conscientious of everyone's time. We're getting close to 8 o'clock here. I still have 3 or 4 questions for the panel at large, but I just want to thank our panelists for staying on so late. This is such important information and such a good resource for the community. And we still have about 60 something participants logged in. So if you're able to stay on for a couple more questions, please do so. If not, we totally and completely understand, and we appreciate your time. Here's a couple questions for the panel at large, including Gayla and folks from Colorado Rising. One of the questions that came up, which I'll go ahead and address, was regarding Loveland and why all of this, why the 26 wells being proposed in Loveland right now are allowed to be proposed, even given what we know about air quality. And I'll say that there's 2 things at play here, and folks can also contribute if they see more. Those that are in power are counting on folks to be either poorly educated or indifferent to what's going on. And so we have to really be the ones pushing for change when it comes to getting permits stopped and getting sites monitored. And my cat's here and he really wants to look at my notebook. And secondly, historically, corporate interest has outweighed public health concerns in Colorado. And we know that the tides are turning, but we all wish they would turn faster. And we can continue to be vigilant and forceful about our public health needs. Does anybody have anything to add to that regarding why wells are allowed to go up, given all of the data that we've heard today? A really hard question to address.
I think the historical record is, and again, this is why Senate Bill 181 is so important. The historical record is oil and gas had their way, and they got pretty much whatever they wanted. And there wasn't, this amount of information and knowledge about the concerns and dangers. That's changing. I think the site in Loveland, the McWhinney group is worried that they may not be able to make it happen. The other thing is, if you can get this, again, there's setbacks. If you can put these wells in before you have houses, that's a totally different story than putting them in after the houses are there. So the setbacks make a difference. But I think, yeah, the dynamic was, well, we get to do this because we've always done it. And now they're starting to see the tides are changing. And the more people that weigh in, the more people that voice their concerns, the more people that say to the elected officials, this has to change, the better things will change.
Thank you. This again for the entire panel. What would we need to have real air quality monitoring in place in Loveland and Fort Collins? In other words, how do we lobby those in power to help us pay for these things where they aren't already available? I know.
Well, again, I'm sorry for waiting, but it's a small price to pay for powerful data. And I think, again, if you don't know your city council member, learn who they are, contact them, tell them they need to watch this. They need to understand that this is important for the citizens of Fort Collins. Contact the wonderful people. I mean, these are marvelous people that are working in city council and on the county commission, and they're trying to do the best they can. I think there's some entrenched systems in place that they have to fight against, but they also represent their constituents. They have to hear from the constituents. So reach out, tell your neighbors, tell them to watch this, tell them, hey, this is really, really important. We need this information. It is not that much money for this big community, for the county to put together these programs. Again, my vote, I'm somewhat biased, but I know Detlef. And the beautiful thing with Detlef's work is we can link it to the other stations and learn even more rather than setting up a brand new monitoring system.
And I would only tag on to that. It's an excellent question. And I would encourage everyone to, as Dr. Carroll said, to contact your local elected officials and ask it them.
And I'll just quickly say, my piece is in that, as I mentioned, I mean, we've passed a lot of rules and regulations in the state of Colorado, both at the state level and at municipal, local levels, county levels. What we haven't done as good a job of is ensuring that those rules and regulations can be enforced and that there's actual oversight of this facility, because so much of the time they are still essentially self-policing themselves. And so the more monitoring that we have, the more technology that's out there, like OGI cameras. If more people were doing what I did, there would be massive benefits to that, because again, so much of what occurs and continues to occur, and so much of what this industry has been able to get away with, is because we can't see the pollution that they're producing day in and day out. If we could see it, if we could see methane and VOCs, this story would be very, very different. People would respond very, very differently to all of this. But this has been going on sight unseen for decades, and we've been none the wiser. We're now armed with technology. Groups like Earthworks, groups like Boulder Air are doing things that before weren't possible, but there needs to be more of it. There needs to be more oversight of this industry so that we can actually enforce the rules that we have on the books.
Thank you, Andrew. I was going to say something similar. And furthermore, from Colorado Rising's perspective, we've learned and we keep learning that there's power in organizing as communities, and there's power in petitioning those in power. Just being an Erie resident, just in the couple of years that I've been here, we have been able to pass air quality monitoring and get Air Boulder to put a station here in Erie. And then we have lobbied for more protective setbacks, both regular setbacks and reverse setbacks, so that folks are better protected from the proximity of these operations. And we've also lobbied and approved measures such as getting noise regulations put in place to help monitor these polluters, and helping to make sure that new incoming residents are informed of oil and gas facilities before they purchase their homes. So I see it in the chat, and I see it in the meetings that we hold every day. Continue to beat that drum and be loud, and make sure that they know what we're learning here today. One last question for the entire panel is money the greatest impediment to the advancement of renewable energy development here in Colorado? It seems so to me, but from my limited
Well, since I've
perspective.
been weighing in all the time, I think yes and no. The problem is it's the entrenched belief systems, it's the entrenched ideas, it's the misinformation. I try to look at some of the dysfunction in my profession as dopamine driven, so that people that do things that are against their own benefit, it's usually because it's a chemical in the brain that says, oh, I've got to have this. What we have to convince people is that change doesn't have to be detrimental. It doesn't have to be problematic. We'll still have our energy. We'll still have our comfortable homes. We'll just be able to extract it in a different fashion. The problem is you're fighting an industry that is making so much money on, and I saw it in the chat earlier, you can't own the sun, you can't own geothermal, you can't own the wind. And they know that. And thus they're opposed to moving away from them controlling the money. So money is an issue, but the ability to move this whole infrastructure into a different place would be profoundly beneficial for many, 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 many Americans, but extremely detrimental for the folks that are profiting from oil and gas. So we just have to recognize they're telling us a complete lie when they say it can't be done.
Thank you. I couldn't have answered that better, certainly. And with that, we're going to close this evening's webinar. Thank you all for hanging in with us for these 2 hours. And thank you so much to our wonderful panelists for all the information they shared with us today. Thank you to Larimer Alliance for helping us host this event. And if you would like more information, please feel free to visit Colorado Rising's website and to contact us with any follow-up questions. This webinar is being recorded and we can make it available upon request. It is also being, it's also on Facebook Live right now. So if folks want to share it via Facebook or other social media outlets, they can. We encourage you to send this webinar to your elected officials, to sign the petition before mentioned. I'm going to put the QR code up now as folks are logging off, and to continue to beat that drum. Thank you all so much for being here.